All right. It takes a village. We got it.
That's about the limit of my IT skills right there.
All right.
That's important.
Well, for the benefit of those joining virtually and those present, we have taken our roll, and we do have a quorum. So we'll call the meeting to order at 6:05 p.m. and begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, we don't need to approve the previous meeting's minutes because we're recording. We have 2 members excused, actually 4 members excused, 5. Okay, so PJ Keeler, Maria Walker, and I'll give you the other couple. We're just having the last person sign in. Yeah, both doctors, Dr. Daly and Dr. McHugh. Oh, no, he joined.
Oh, okay.
Yep, so only 4 people. And with that, you got the floor, Tim, Executive Director's Report.
Okay, hopefully everybody can hear me. I'd like to kick off by just introducing to everybody that's on the meeting to Beth McGowan. Hopefully you're aware Beth is our new med standards person, and she's adjusting nicely into her new position. And I have to tell you, it's great to have a full-timer in there. So welcome, Beth. And if the group has any questions for Beth, feel free to reach out via phone or email. Her email address is bmcgowan@remo-ems.com. So once again, welcome aboard, Beth.
Thank you very much, Tim.
Typically in September, we present the Remo annual operating budget. We're going to hold off for a month because we're keeping our fingers crossed, and we're hoping to receive the consolidated Remo Aram's budget or contract, which would make it easier for Dave and I to crunch some numbers going into the following year. So hopefully we'll receive that, and we'll be able to toss out a budget proposal for the October meeting. On a semi-related note, we have not received the Ruber Program Agency budget increase. I assume that would be incorporated into that contract. I'm not sure of the percentage. I've been hearing 10%. I don't know if Steve's heard anything different or not, but we'll take whatever we can get. So Remo training, both the fall EMT and AEMT classes have started. They started a couple weeks ago. The AEMT has 13 students enrolled, and that's the most we've had in a while. That's a good thing. One other update, Remo will be sponsoring, and this is in collaboration with Hudson Valley Community College. It will be held at HVCC, a full CLI course. That's going to start November 14th. Additional info can be found on our Remo website. CMAC and Remsco, I know Steve will talk to that. I don't have much to say there. A couple things relative to EMS awards. One thing that's great for our area, Michael Prezioso from Clifton Park Half Moon received the state award for excellence in EMS quality and safety. Excellent job there. The second related item for EMS awards is Director Greenberg has advised that DOH will be opening up the awards portal early this year, Carol, November of this year, to hopefully encourage more submissions. Just a tidbit there, out of the 18 regions, only 7 or 8 submitted nominations this year. Obviously, we were one of them, and Ames was one of them. The REMAC Advisory Committee and the REMAC have decided to combine their meetings, and there's going to be a new monthly start time. Every month that they meet, they'll be starting at 2:30 p.m. I just sent out the October invite. If anybody hasn't received it that wants it, let me know. But once again, they'll be combining, and they'll be meeting at 2:30 p.m. moving forward. Just want to toss that out there. We talked about this going back maybe April or June about an awards banquet. You know, and if we do one now, if we combine it, a Remo, Aram's Award banquet, what I think I'd like to do with the annual budget, I may incorporate a line item again, to fund the budget, or a correction, to fund the banquet. I know Steve, a few months back, tossed out perhaps the DBEMS may have the conference room available for something if we decided to hold something. He's shaking his head affirmatively. So Dave and I'll sit down, we'll see what type of money we have. I'll throw a new line item or add another line item into the budget for a banquet, and hopefully we get some folks together and recognize them the way they deserve to. And I'd like to also, if we have it, we'll call in last year's award winners too. We'll recognize them as well. I believe that concludes my report. If anybody has any questions, I'll be happy to answer.
Excellent. Seeing nothing specific for a chairperson's report. I don't think we have anything specific to issue discussions, which would bring us to operational reports, which may be just as brief. Medical Director Dr. Daly is excused. REMAC and Academic Dr. McHugh is excused. PJ, also from a treasurer's perspective, is excused. Dr. Daly also falls into the QI report, excused, and I'm happy to report that there is nothing before us from a CON committee standpoint. So that brings us to information sharing. Have 3 disciplinary actions to read into the record. Andrew DeWolf of Lyons, New York State EMT number 232204, had his certification revoked effective 8/26/24, and he was assessed a civil penalty of, and you saw it if you had this in your agenda and read it, of $26,000 for violations of Part 800.16A. And that's, didn't put that in there because that's a significant number. I don't remember ever seeing anything quite that high, but it is correct. James Wilkinson, Syracuse, New York State EMT number 458352, had his certification revoked effective 9/4/24. That revocation was stayed pending no further violations during the probationary period, and he was assessed a civil penalty of $6,000, of which $4,000 was stayed for violations of Part 800.15A, 800.16A2, and 800.16A13. Vincent, New York State EMT number 51439, had their certification revoked effective 9/10/24 for violations of Part 800.16A6 and 800.16A10. And there's no reference to a fine in that one. A couple course advisory. Mohawk is having an EMT, and that starts on 10/21. And Guilderland EMS is also having an EMT that starts on 10/8. Nothing to report other than we just had relative to correspondence. Committee reports, executive, we did not meet. Steve Kroll for finance.
A couple things, thank you. First, Tim did mention that the program agency contracts have been delayed. This is a matter of a lot of discussion last week at the State EMS Council meeting. Program agencies were supposed to have their new contract on July 1st. It's supposed to contain an approximately 10% increase, and it's supposed to be a 5-year contract. They are now held up, not at the Bureau of EMS, but in the bigger portal of state contract approvals. The program agency directors made very clear that this is a problem for them, and they need it to be accelerated. What can be done or will be done, I can't tell you. I do want to tell you about 2 things that are going to be in those contracts. Number 1 is, in addition to whatever appropriation each program agency receives, they're also supposed to receive a $15,000 amount per year for recruitment and retention programming. Because the program agency here works in 2 regions, we will get $15,000 for each region, so a total of $30,000. I bring it up here because, how that money is to be spent, we're gonna have to decide. It is not going to be there will be guidelines in where you can and can't spend it. But the region is gonna need to develop a reuse. We'll have basically the two regions will have $30,000 between the two Remscos to develop EMS recruitment and retention materials or programs or whatever. So I think that is an opportunity for a issue discussion, a committee or whatever. So that Tim has guidance when that money comes in on how to spend it. If the contracts are late, he will have a very short time in which to spend the first year's money. But then he'll have 4 subsequent years of money. So effectively, if you take 15,000 times 5 years, times 2 regions, that would be $150,000 over the next 5 years between the 2 regions to spend on recruitment and retention. You'll probably do some pretty decent things about that. The second pot of money that will be in there is $20,000 for the education of paramedics. This is because New York State is going to be hiring approximately 80 paramedics as part of their New York State Task Force for Emergency Response. And the field's reaction was, you're taking 80 paramedics off the streets at a time when there's a paramedic shortage. We asked the state to fund paramedic training to replace those paramedics. Each region, and again, so, this program agency represents 2 regions. So there'll be $20,000 a year in this region. We'll get 40, even though this Remsco only controls 20. The Aram's Remsco controls 20, $40,000 a year over the next 5 years. That will be for the purpose of educating 2 paramedics per year per region. So between the 2 regions, 4 paramedics. The mandate will be that we have to provide those funds for at least 2 paramedics. If there are any monies left over, we could use it for additional. The reason behind that is there are 18 regions in the state times 2 paramedics, that's 36 paramedics a year, times 5, that's 180 paramedics. So the state's going to take 80 paramedics out of the workforce and pay for the training of 180 paramedics. So again, we're going to have to decide how to use that money. Will it be a scholarship program? Will it be a competitive scholarship? Will it, how, we're going to have to identify 2 people that we will pay to become paramedics. Will there be a requirement that they stay in the region and serve? All those things will have to be worked out. But that money will be becoming available, and we're going to have to set up our rules and how we want to do it. So that's sort of a heads up for everybody. So, 2 not insignificant things that will be added to the deliverables of the region, but will be funded. And so I bring it forward for everyone to figure out how we want to implement it when it gets here.
One thing to consider, everybody needs to remember that our contracts are reimbursement based. So I brought this up at the state program directors meeting to one of the contract folks. We're going to be expected to outlay that money up front for that training, however we see fit, do it. And then we voucher, submit our claims afterwards for reimbursement of that. So we have to make sure we have that money in the bank up front. So maybe now's the time to start pre-planning for that. So.
And the good news from the finance committee is we do have money in investments. That doesn't mean we want to take it out of there, but there's enough money in investments if we have to front as a region, $20,000 or $15,000 for it to be reimbursed. We have that money in investments. We just have to recognize that the state is not, sometimes they're faster than others at paying the receipts of the regions. And, Tim will come here every once in a while and tell us when it's gotten really, really bad. And then we make some contacts with people and we try and work through the vouchering process. That's it from finance.
Any questions for Steve under finance? We'll keep you front and center for New York State EMS Council.
Okay. EMS Council met last week. We also had the New York State EMS Memorial. I'd like to thank all the agencies from our region who came and brought ambulances to the memorial. Many of you may know that the memorial was full. Literally all 100 spots on the memorial were full. And the Office of General Services has built a new EMS memorial on the same spot. They chose not to expand the existing memorial, but to build a brand new one. It's a very large block of granite with inscriptions in the Tree of Life. It's, only about 200 feet from the state capitol for anyone who wants to go see it who hasn't seen it. So it was unveiled. The Lieutenant Governor came, 8 names were added to the memorial, 7 for members of the fire department in the city of New York who died from post 9/11 illness. The memorial will be officially dedicated in May during EMS week. This year, the memorial was postponed from May till September because there was no memorial. They were in the process of removing the original and placing the new memorial up there. So during EMS week, there'll be something more, but we appreciate that probably 10 to 15 ambulances from our region came and lined the plaza for the ceremony. The Part 800 vehicle regs that have been out there had the comment period has been closed. Many agencies did comment on the regs. The Department of Health is assuming that based on the number of comments received, that there will have to be another comment period. So those regs are going to go through another cycle. But thank you for everybody who shared their input with the Department of Health on the regs. The next set of regs that is coming through is going to be the performance standards. The state budget from last year required that the State EMS Council begin putting in place performance standards for EMS agencies that are required reporting of data. Those regs have now been put together. And so agencies are going to have to report on their responses, their response to mutual aid requests, their use of mutual aid. Basically, people are going to have to go public with whether they answer their calls or not. So keep an eye out for those regs. And again, there will be an opportunity for EMS agencies to comment on them when they are published. And, they're going to be basically looking at, the first round of these performance standards is going to be designed to shine the light on EMS agencies that continue to hold operating certificates, but do not answer their calls. I don't think for most of us that serve in this council, this will be an issue for us. We're in a region with a lot of high-performing EMS systems, but there are EMS agencies that still continue to bring in money and then pass all their calls off on mutual aid, and that will be seen. So that's coming. Please keep an eye out for that. There are 2 pieces of legislation that have now become law based on the work done by the EMS community in the last year. Last week, the governor signed the bill that will allow ground EMS units to do blood transfusions in the field for trauma patients. This is something that's happening in some major cities around the country and some rural areas with really great peer-reviewed, academic-reviewed results in life-saving trauma patients. Currently in our region, basically the only way we get blood in the field is if someone from Albany Med gets in the Albany Med first response vehicle and makes their way out to carrying the cooler. There will be a regulatory process on how to implement it. I know Dr. Daly's not here tonight, but he's been involved in the discussions that are already underway about how this will be regulated. But pretty soon, if an agency wants to carry whole blood, working with a blood bank to make arrangements to have it, that will be a possibility in New York State. Don't know if that's something that will be frequent in this region, but I know that in some major cities around the country that have very high volume EMS systems with a lot of trauma, it's made an incredible difference in life saves with car accidents, gunshot wounds, etc. The second piece of legislation that the governor has signed is the Treat in Place and Alternate Destinations Bill. It now goes to it's now law. And New York State, with the help of Mr. Brandt of the Health Department, has filed a state plan amendment with the federal government, which must approve that because they pay half the money. 4 other states already have this, so it's not going to be a controversial state plan amendment, but basically, the federal government, once the federal government approves it, New York State's Medicaid program We'll pay EMS agencies that do treat in place, and we'll pay EMS agents that take people to alternate destinations. We don't have a very robust alternate destination program in our region, even though I know Clifton Park, Half Moon, and agencies in that area have the ability to go to the Ellis Medicine facility there. The hope is that with this being passed, more alternate destinations will be developed. These crisis response centers that are being talked about, the state is opening crisis response centers that will allow for ambulances to bring people with mental health crisis that are not hospitalization in. Under Medicaid, we'll start getting paid for it. We will get paid the same thing we get paid for transport without the mileage. So a BLS fee schedule on Medicaid now is $249.60. We'll get $249.60. ALS 1, I think, is $296. ALS 2, 4 or something. This does mean that for a cardiac arrest that we secure in place, we will be able to get paid by Medicaid. For a diabetic wake-up call that we leave at home, we'll be able to get paid by Medicaid. But it also opens up the possibility for agencies to look at other ways of doing treat in place, whether it is working with a telemedicine physician, which some of us had done in the past before that program ended. I think the nice thing about Medicaid doing this is that it is going to put some pressure. The state's doing it, is putting some pressure on Medicare to get their act together with this, and their NAMT is working on legislation to do that with the AAA and the International Association of Fire Chiefs. In addition, put some pressure on insurance companies to do the same thing. Some insurers are paying for those types of things right now. So good step forward for us. But at the very least, for things like securing cardiac arrests and diabetic wake-ups and car accident assessments with RMAs, Medicaid will start paying for that, and that's going to be some money in our pockets. So those are the major things I have to report from State EMS Council meeting. The EMS Council meets again in December. A lot of things are starting to move, as you can tell, in the legislative and regulatory process. There's a hell of a lot more to get done. I have no update for you on the vetting of our new regional rep. As you know, we submitted Steve Meehan and Carol Brandt as the people to take over the seat since my term has expired. They have filled out their paperwork. And have you guys filled out your paperwork?
I haven't
Okay.
gotten anything. I haven't heard anything.
All right, well, what's supposed to happen is the governor's office is supposed to reach out to both of them. They're supposed to fill out paperwork, then the state police investigate them. We have a lot of seats that have not been vetted. Because this is a statutory body, you cannot be a voting member until the governor's office basically gives you a seal of approval. They have to choose between Steve and Carol. I remind the director of the Bureau of EMS on a regular basis, and I think I've asked Tim to remind him as well once or twice, that it has been quite some time. I think you guys were nominated almost a year ago.
It'll be 2 years in
2
February.
years?
I think
Okay,
it's
so,
right.
so we've reached a point of ridiculousness. Now, the good news is I am allowed to continue serving until I am replaced.
It's all part of the plan, Steve. It's all part of the plan.
Well, there are a whole bunch of regions that are in the same, there are a whole bunch of regions that are in the same place, and I don't think it's fair. I've served and I appreciate the region that has nominated me for a number of years. It really should pass on to a different generation of leadership or new leadership. I keep asking, it's not just our region. There's some regions that actually have vacancies where the person that was serving has left and they can't get a new person on. It's not, I don't think anything's gonna happen between now and the election, I just want to be upfront that we do keep asking them. I'm really surprised that they haven't even contacted you guys. I know that they have done some vetting of CMAC members. And I know Dr. Afienko, who is going to be the new member of CMAC from ARAMS, has gotten his approval. They had to put the gas on it because CMAC could not get a quorum. CMAC had failed to reach a quorum for 2 meetings because doctors had left. I think they pushed a few doctors through, which was surprising to everybody, but we'll keep pressuring them on the Remsco side. And I think that's pretty much it. The next meeting's in December.
Anyone have a question for Steve? I just had one and I may have read it wrong when it was out there. The paramedics that the state has described as, the 80. I may have read that as that they would be like a reserve corps that would be called up, but is it actually these people would be essentially become full-time employees of the state? Is that how they're envisioning it?
Yes, the state is envisioning a number of pieces to this task force. When they need to mobilize ambulances, that will be done by contract with existing ambulance providers. So, they may have a contract with Galatia, Mohawk, or Rotterdam, that if we call you, you'll send an ambulance and we'll pay you, $1,000 a day or whatever.
Yeah.
In addition, they're going to have a ready response workforce of paramedics. There should be one paramedic unit per region of the state, and I think it's divided into 10 regions. Based on the economic development zone, so not our region, so.
Yeah.
And those paramedics will be in flight car vehicles. And part of their job is to maintain readiness for disasters. So they're gonna be, similar to the OFPC model, they're gonna have stockpiles of stuff that they're responsible for taking care of. They're able to be deployed in mutual aid circumstances. So, not really something that happens in Albany County very often, right? Because we have got a lot of high functioning paramedic agencies. But, might they be called in to help out in rural Rensselaer County when BLS agencies don't have ALS available and we start to see calls? That is entirely possible. So these 80 will be stacked. So like 8 paramedics in each region of 10 to make a 24-hour schedule, basically. So they will be full-time state employees. They're going to be probably functioning at the highest level of scope of practice that we have. And they will be hired incrementally. I don't think they're going to hire it. I mean, my guess is that in the first year, they may be going to hire the first 10, 20 of them and then keep building. I don't think that they have the ability to hire 80 in one shot.
And just out of curiosity, because in the back of my mind, it triggers the CON issue. So at the point that a region all of a sudden has this component of a response, which is New York State, is that where do they fall? Has that been
I
discussed?
think they fall completely outside of the CON regulations. They're New York State employees. They will be assigned to territory. They will operate in that territory. I would presume that New York State will not be billing for these services. These will be paid for by them. So it's not like they're going to be stealing anybody's revenue. They're not going to be stealing anybody's transports because they're not going to be working in ambulances. But I'm pretty sure that New York State is not going to make themselves subject to their own CON rules. That's only for us.
It's interesting. And again, I may have misunderstood it or didn't fully grasp it, but I guess, in terms of home rule and some stuff like that, I think the fire service has probably, graciously accepted the stuff on the OFBC side. This just seems like it's a little grayer than I would imagine.
I think when you say the fire service has graciously accepted OFPC, that there were probably ebbs and flows and ups and downs in that relationship over the years, and they have reached an equilibrium of coexistence. I would suspect we will go through that same process, and in some regions, you might find an state EMS worker who pushes boundaries that causes discussions back and forth, and it will again find its equilibrium over time.
Very good. Thank you. And just a side note, again, I don't know if you guys saw it. I think maybe Tim had put it out, but as it relates to the process with the use of blood pre-hospital, I think PJ from Columbia County and Report Rescue did a nice job with a little, PR thing where they, gave a local legislature or legislative representative some, some airtime or some showtime. So that's good. And you guys always work on that as well. So thank you, Steve. Nurses, Anne Marie.
Yeah, we had our meeting on September 19th. We had a good turnout. Most of the hospitals in the region were on the call. We talked about EMS transfer concerns, overall transfer delays. So one of the, the continued issue is the lack of resources, offload times, Glens Falls reported 150-minute average time to get LVO stroke patients out the door. So they were, they had a lot of concern about that. Most of the hospitals are not aware of the current and or upcoming plan for ambulance resources once all the local ambulance resources have been exhausted when there is a critical patient to be transported. After our meeting, Beth McGowan did reach out and contacted Mary Ramo. I'm sorry?
That was just background noise. Keep going.
So Beth reached out to Mary Ramo, contacted her and asked her to make a presentation to the nurse committee about the New York State Surge Operations Command Center. So Mary agreed, and she is going to present at our November meeting, which will be great because most of the hospitals they weren't aware of that. Second thing on the agenda was completion of PCR reports, not getting completed by EMS providers for several weeks to months. One of the hospitals reported that Department of Health was recently there. They were looking for the reports. Many of them were not complete. Carol was on the call, and she did say she would bring it back to her agency. So hopefully, we'll be able to reach out to some of the others and just have them, try to get those PCR reports completed. And the third thing was Pulsera reports. Issues regarding ED notifications of the Pulsera reports with very sparse information. At times, only a name and vague complaint, no vitals. Some reported no other information on the patient's condition, mechanism of injury, etc. One hospital had reported that they received a Pulsera report of the patient, quote unquote, patient not feeling well, and EMS arrived bagging the patient. So, the nurses said they're not looking for a comprehensive report just if they can get more information, because they can get more information on arrival to the ED. Their immediate goal is just to identify critical or unusual patients who may require intensive or special resources on their arrival. And then the nurse committee requested that a proposal to the Physicians Council to initiate a medical advisory policy procedure to standardize the use of Pulsera by EMS providers. And Dr. Daly was on the call, so he did get that request. The fourth thing on the agenda was the Pulsera versus LifeNet. We have been talking about this for a while. It's great news that the Albany Med System has budgeted for Pulsera upgrade for 2025, which will include all the system hospitals, Glens Falls, Saratoga, Albany Med, and Columbia. And this upgrade will include transmission of EKGs. St. Peter's Health Partner also reported that it was in their budget for 2025. That will include St. Peter's Hospital, Samaritan, Albany Memorial. And then Ellis also said they're budgeted and they plan to go live with the upgrade. They said very soon. They don't have an exact date. So that's good news. The fifth thing I was asked to bring up on the agenda was the ED nurses, the witnessing of waste of narcotics with EMS providers. This was an issue that Ellis had recently, and Ellis was on the call. They did present some information about concerns that they've had recently with some of the nurses. Ellis did put out a new guidance. They referenced the Department of Health BEMS policy that certified EMTs may waste. Clarified that, we clarified that we're not witnessing the narcotic waste. We are just witnessing the volume of the liquid in the syringe. Both EMS and ED are really looking at the same and kind of facing the same problems from both sides. We think that there needs to be language, a clarification of the documentation, the language of the documentation, so that both facilities will feel safe, the nurses and EMS. So offline, Laura from Ellis Hospital, Carol Brandt, Dr. Daly, and Brandon are going to meet offline to see if they can discuss some potential solutions going forward. And the fifth on the agenda was the CARES data. Dr. Daly did present this overall 3 to 4 years as a region. We've had the CARES data and 6 years overall. He presented like 4 to 5 hospital data points, didn't get into the specifics, did not have, we do need our regional report to do the specific data. But it gave an overview to the nurses about the cardiac arrest and, what the CARES is. And then Albany Med just said that there are a lot of IV pumps in the EMS room, so requested that the nurses pick them up, and they all said that they would try to do that. Our next meeting is November 14th. Are there any questions?
All right, seeing none, thank you, Anne Marie.
Thank you.
PJ Keeler is absent for MCI. Lynn Kane, membership.
Good evening. I have a small list of folks that need reappointment. First, PJ and Steve Meehan need their county reps, so their letter will be submitted by the November meeting that we have. Spoke to Mr. Salucci, who has graciously said he'd stay on. So I make a motion that the reappoint Rich Salucci to another 4-year term.
All right, I have a motion by Lynn, a second by
I'll second.
Carol Brandt. Any questions on the motion? All right, does not need to be a roll call, so I think it's easier to simply say, is there anyone who would choose to vote no or would like to abstain? All right, seeing none, we'll call it motion carried. And Lynn has several of these, I believe, so back to you, Lynn.
Okay. We have Adam Fink, who has also graciously offered to stay on the council to help us. So I make a motion to reappoint Adam Fisk to a 4-year term on the council.
Very good. Do I have a second for that?
I'll second.
Second by Carol. Any questions on that motion? And again, we'll use the same procedure. So if anyone is interested in abstaining or voting no, please feel free. If not, we'll call it a motion carried. Seeing none, back to Lynn.
We have Jim Stairs, who is up for a new appointment. So I make a motion for Jim Stairs to be reappointed to a 4-year term on the council.
Thank you, Lynn. A second?
I don't know about that.
Hey, help me out.
Sure, we'll second.
All right, Carol with a second. Use the same procedure. I guess I'll abstain from voting for myself. So other than that, anyone wanting to vote no? Seeing none, we'll call that a motion carried. Lynn?
Next, we have Steve Kroll, who has graciously offered to stay on. So I make a motion that we reappoint Steve Kroll to another 4-year term on the council.
Very good. Do I have a second for that? Second. Any questions on the motion? All right, seeing none, same thing. Anyone choosing to vote no or wishing to abstain? All right, we'll call that motion carried. Thank you. And I believe you have one more, maybe, Lynn?
2 more.
Ooh,
2
all right.
more. And someone's going to have to help me, maybe Tim Mirabili. Paul, Sugue. How do you pronounce his name?
Segru. Yep.
Segru. He advised me he is retiring from all things EMS at the end of the year. So that will leave an at-large chair open. So we can put that out there, see if we can find somebody else.
Find out who Paul's successor would be at Colony EMS. And I think it might be Eric, but I don't know for sure, but
In the running, I don't know.
I mean, I think that having one of the largest agencies represented makes sense, so I wouldn't fill that until after Paul's spot is replacement is revealed.
Okie dokie.
I was gonna say, are you comfortable doing that, Lynn, reaching out to Colony and see who they
Yeah,
would?
I'd
Okay.
be happy to.
Paul probably doesn't know at this point, he won't be involved in announcing his replacement, but at some point, the town will.
Yeah,
And I
it
was gonna say,
should
no,
be
go ahead,
Erin
Paul.
Kelly, but they could do whatever they want. I will ask her. I think she will be a hard no. But I will ask.
Lynn,
I-
just from no, I was just had a question from your perspective, and just for a quorum issue. Would it be your recommendation that we reappoint Paul to serve till the end of the year?
We could. That would be acceptable, and then all I would ask of Paul is to send myself and Tim a brief email saying, resigning, retiring as of such a date.
Okay, will do. Yeah, December 19th is my last day. So
3 days.
Okay,
You know you have a countdown time.
Yeah, we're
So-
teasing. How many days?
oh yes.
so I make a motion that we reappoint Paul to another 4-year term on the council.
Sounds good. Do we have a second on that?
I'll second it.
Okay. That was Anne Marie. And
Yes.
again, we're assuming that Paul will send in a resignation effective, I think it's December 18, which would be his last day, and then we'll readdress appointing his replacement at that time. So unless anybody has any questions on that motion. Don't see any. So we'll do the same thing. Anyone wishing to vote no or abstain?
I guess I'll abstain from my own vote.
Sounds good. Taken. That was Paul's.
Yeah.
And with no other responses, we'll call that motion carried. And Lynn, you have one
Okay.
more, please.
Well, 1.5. The half is I've tried diligently to reach out to Alan Bell today. Alan, are you on this call? Are you in the meeting?
I don't see him.
Yeah, I don't believe so.
Okay, so I couldn't confirm with him his intent. So I'll make attempts before the next meeting to get an answer from him. That leaves us with me. I asked myself if I'd like to participate and I said, sure, but I feel weird about making a motion for myself.
Well, I'll be happy to do that in your if you're uncomfortable. So I would make a motion that we approve Lynn Kane for 4 more years of service on the regional council. Is there a second?
I'll second that.
Yep, and I was gonna say Steve Kroll beats to it, but any other questions on that, or any questions on that motion? Seeing none, anyone wishing to abstain or vote no?
I guess I'll abstain.
All right, Lynn abstained. Other than that, we'll call it motion carried. Again, thank you all for your patience and us fulfilling a parliamentary requirement there, and make sure we have everybody in place. Alan may be a little bit of a challenge to get a hold of. I think he travels for business, so that may be why you missed him. But I'm sure he'll hook up eventually.
Well, I'll make every attempt.
Okay, terrific. Thank you. Nominating, I think is not here, so I don't think there's anybody else.
Right there.
Oh, yeah, what am I saying?
I have
Right.
nothing to report.
Okay, sorry. Excellent. Nothing to report. Awards, Carol Brand.
I think Tim covered the fact we had a statewide winner, so that's excellent. And apparently they're expanding out the nominations, which was news to me, so that's good. I assume they're still due the same time. Yeah,
Yes.
so that gives us quite a long time to try to get nominations. So we'll have to redouble our efforts and see what we can do for this coming year.
I just got a question. It was an email interaction with Dr. Daly. You guys will remember we had a physician who was, active with EMS pass unexpectedly. And the interaction that I had with Dr. Daly was, I don't know that it's something they would want to do. And I couldn't remember a situation where a person had ever been presented for a posthumous award, or if the state had ever done anything like that. Does that ring a bell with anybody present or,
Well, rumor has it Philip Malady is under consideration this year for a similar type award. They don't know if it's been approved yet or not.
okay.
That's not a bad idea.
Yeah, I mean, I'm just throwing it out again, and I apologize. The interaction was with Dr. Daly, and he's not here, so I don't know if he had more information on it, but it's just something I'll throw out to the group for consideration. Obviously, it doesn't happen that often, but if somebody could be recognized for their service, that would be great.
I see where there would be a harm in if the logo, if we choose, if the state opts not to recognize it, that's their prerogative. But from a council point of view, I don't see why we couldn't. put that-
Yeah, and there's I don't know when it was. I mean, it's probably a couple months back. I mean, Remo, created an acknowledgement for his service. And I think this would be above and beyond, or just something different that we could do locally.
Sits in my office, just waiting for the Remax to decide how to formally
Should
recognize.
probably
it.
remind them.
I believe Dr. McHugh was working on that.
Okay.
So,
Yeah. Was one another thing where it came to a realization as summer was approaching, and now that summer's over, I'm sure they'll pull it together. County reports, Albany County.
Nothing to report.
Great. That was Dennis Wood. Columbia County. Great, Steve. Greene County. Yep, Steve Neer.
Actually, something to report this month. A few months back, maybe 6 months ago, 2 or 3 of the supervisors in Greene County approached our legislature and asked them to conduct a county-wide, or that's what we've dubbed it, EMS study of the current system. That study is complete. It's posted on the county's website if anybody's interested in reading it. And the same company did one for Columbia County as well. And they proposed 4 options of how the county should look at moving forward with their EMS system. No decisions have been made. And that's all I have.
Very good, thank you. Rensselaer County.
Just a quick update. I know I've asked a few of you for MCI policies. We finally got together. We've updated our policy, just waiting approval from our Director of Public Safety. And then I'll get a copy over to Remo. And that's all I have for today.
Great, that was Ben Bornhorst, Saratoga County.
Hi, it's Tracy.
Yep.
Saratoga County, we held a countywide Narcan training day on August 27th. We had 29 locations, 12 different ambulance services in the county. 530 people were trained that day, and 768 Narcan kits were distributed on that day.
Wow. And if you didn't hear it, they said that's pretty big from the comments here. So thank you for that. Schenectady County, Jim Vina.
I wasn't at the last meeting, so I'll defer to somebody who was. Peter, Jeremy, anybody? All right, we'll call it no report.
All right. Just as a side note, it's always nice to acknowledge, wait, do you want to?
Sure. So, regarding Schenectady County, we're doing some initiatives with response times, and we're looking to collect some information about response times in the initiative, a whole quality metrics thing that I know is coming up, and we're looking at that. Other than that, there's no major changes in Schenectady County.
Sounds good. And just, I'm sure you missed some of these I know about, some of them I don't, but when we last met, Jim Vina had a different rank than he holds now. So Jim Vina is now Chief Jim Vina. So congratulations on that change in your status.
I haven't received any letters from Dale.
Thank you.
I don't know what Dale's intention is.
Hi, I'm here.
Hey, all right, Dale.
Are you going to hang around?
I'm still going to hang. I actually failed in retirement and took a part-time gig with the county as assistant fire coordinator. So I'm still in the game a little bit, but Jim's having all the fun.
That's it.
And I'm sure he's not grinning right now.
You have given the baton to him.
Absolutely.
All right, thanks.
One way to put it.
As far as new business, which is kind of old business as well, Dr. Daly had mentioned this at some point recently, and it's certainly is something worth considering, and certainly in light of Steve Kroll's description of the funding coming from the state and us having to determine what to do with it, is Carol mentioned maybe 7-ish years ago had a kind of a Remsco retreat where we attempted to, I guess, to chart the future for Remo. So it's probably not a bad idea to consider doing something like that. Obviously, everybody's time is precious, so I don't see us going away for a weekend. But, you know, an afternoon with a couple hours set aside is probably something reasonable. So I think we'll probably have Tim send out an email to everybody and see what their thoughts are on this, and maybe we could be, I don't know, very hopeful that we could maybe pull it off this year, maybe early November or just after the 1st when people have some free time because it's winter and there isn't that much stuff to do. But that's just something as far as new business. Anybody else have anything they want to bring up other?
Do you have any sense of what the agenda will be, Jim?
No. You know, part of it is we could revisit what the old, you know, marching orders and goals were, and then go from there.
I think that to make good use of our time, you should, either you or Tim or someone needs to be the leader of the retreat.
Yep.
And have a concrete agenda of what you want to accomplish. You know, maybe you vet it with a committee that works with you in advance. I mean, when we did it 7 or 8 years ago, we brought in an outside facilitator who had concrete instructions on what we were going to do that day. Like, we decided our plan is to leave with X, Y, and Z. Whether it was right or not, I can't tell you, you know, looking back, but that was what made that a very effective day. Otherwise, sit around and just talk to each other in abstract about all the things we hate about EMS, all the things we want to change about EMS, but the real goal is to leave the deliverables that we're going to do this.
Yeah. Do you, just out of curiosity, recall, was that done on a weekday or a weekend, or when was it accomplished? Do you remember?
Yeah.
Weekday?
All of that office park on Western,
Yeah.
next to the through.
Yeah. Fall Oaks or something that's over there.
Yeah, you know, again, we'll
I might
send it out
still have
for
some.
comment. You know, if somebody has some paperwork on it, that would be great. And maybe by the time we're, you know, together again, we can have better lines to work within, for lack of a better description. Just another item, which is probably more old business, is obviously we've attempted to mirror the max meeting frequency. So our next meeting would be in October, and then similar to the MAC, we would have another 3-month or 90 days is a better way to describe it, a period where we would not meet. Again, the biggest reason we would be called to meet in times like over the summer or at any point when we are not typically meeting is because statutorily we have to meet a timetable as it relates to a licensing issue. But so far, unless somebody has feelings differently, I think the pause over the summer worked great. Had a couple conversations with Tim, and you know, it was smooth sailing. So I think that worked good. As I said before we started the meeting with some of the folks who were here, I think EMS is as representative of society as anything else, possibly more, where you know, you're being called to do the same amount of stuff, if not more, with fewer people. So at any point where we could potentially save someone the opportunity of having to attend a meeting virtually or otherwise, when they could do something else with that time, is probably a great opportunity to, you know, use your time effectively. Again, not that this isn't productive, but if we can remain as productive as we are without having to meet, I think that's a good thing.
So what are you saying? We're not going to meet? When are we going to meet next?
We would meet again October 28th. The meeting that we would not have would be November.
and we meet again in December.
No, we
Well,
wouldn't.
the problem is that's the problem. If we follow the Remax schedule, they're beginning of the month, we're end of the month. So the problem is if we follow that schedule, we're meeting the week
Well-
of Christmas. So I think we should, if we're gonna, I don't know if that's the best answer either.
Well, I'll just make a comment. I think that the answer to being productive is not having less meetings, it's finding things to do in those meetings. We just brought up that we have to do something, we should do something on recruitment and retention. We've brought up that we're gonna have to do something around paramedic training, funds. We just brought up, we want to do some planning. So to me, the natural answer to that's not, okay, let's meet, let's try and cut our meetings. I mean, we can either just say, Tim, you're responsible for everything and do it yourself and tell us how it worked out, which I guess is one strategy. Or we can, as a council, start tackling some of these things and doing it. I mean, I think it's kind of counterintuitive to come up with things we want to do and then say, well, we want to meet less.
I'm thinking we should maybe consider mirroring the state's way of doing things with the subcommittees, because I think they're doing really well with having the subcommittees meet and tackle individual projects and then bring it back to the bigger body.
Yes, and the
Um,
subcommittees meet monthly.
They meet
And they
monthly.
bring it back to the Remsco that meets every 4 or 5 times a year.
Right,
But right now, we don't really have any functioning
right. I think we
subcommittees
should
except
look at
for,
expanding.
you've got an
them.
awards committee, but it's like pulling teeth.
It is.
And Lynn's got a membership committee, and for
Oh,
Lynn, I
fun.
think it's like pulling teeth, and so,
Well, I think if we came up with subcommittees that had more of a charge to them, such as the recruitment and retention and, planning, take the awards and expand it to like a banquet planning and whatever else we had on our list of things to do. I think if we had more of a focus than the I was thinking too, like the MCI committee, how we're working on that. So for those of you who don't know, Steve and I are on the safety committee. One of the things the safety committee is working on at the state level is like a severe weather hazardous response type plan. And I think maybe that's something our MCI committee could maybe look at putting together for the region, because I think, the whole state deals with different types of hazardous, weather. We've had some flooding out in Schoharie County. They've had the snowstorms out in Buffalo area. They've had flooding and hurricanes on Long Island. So I think we should maybe, but I don't think anybody plans for that. They kind of think they know what they would probably do, but I don't know that anybody has a guideline or a best practices sheet. So that's kind of what we're working on that level. But, regionally, we should probably at least interface on some of that stuff.
the example that was used was Western New York received something like 6 or 7 feet of snow over a 2 or 3 day period. And it was in a 60-mile long, 5-mile long belt, but it was completely paralyzing. And their after action report was, this is Buffalo, it snows in Buffalo, right? All the time. They had no ability and to figure out, they still are asking themselves questions like, when the weather gets bad, do we pull our ambulances off the road? Do we prioritize our 911 calls when we get in that situation? Or do we go to a sprained ankle that takes us 2 hours to go while a stroke is waiting, right? All those are things that certainly could be, be talked about.
Yeah, and I think, Carol said essentially the same thing I was going to say, and it has partially to do with meeting frequency, but it's when do you move processes forward? Not that our meetings and the discussions in accordance with this particular meeting are worthwhile by any stretch, but would we be better off to, as Carol said, create a committee that would look at something and bring that information back to the meeting? So it's just open for discussion.
I would have, definitely not looking to.
Yeah, the volunteer is.
I personally feel that we need a committee to work closely with the local hospitals on regular day-to-day issues that are arising with EMS organizations. Notifications to Pulsera, wait times at the emergency rooms, EMS preference when dropping off patients in triage areas. I don't know if it's enough. I know I see it with our organization and other organizations in Columbia County. It's not enough to just get brought up during a meeting in this forum and having no substance go anywhere. And it's difficult as an administrator, obviously, to voice concerns of staff that we have and knowing that it's only going so far.
Yeah.
Like I said, I would definitely be an advocate of some committee that could meet in almost a liaison capacity, whether it's close and looks similar to like the nurses committee.
Yeah.
But, works with, designated individuals at the hospitals to try to work on some of these issues that we collectively as EMS are dealing with day to day at local facilities.
That's kind of like a parallel, I thought. So, I mean, I agree with you, that should be a separate committee other than the nurses committee.
Yes.
But the point is, though, I think that committee structure coming from the CMAC would definitely benefit us here.
Yeah.
And I think that the committee, the list of committees can be a little bit more robust than what we actually have here.
Yeah, I think maybe
Like
we,
if it's an operational subcommittee or something that is being able to, retrieve readily information from squads within our remote region that can then compile that information and try to work towards solutions with that. So I had some examples down tonight that I was hopeful that Dr. Daly was going to be here specifically for Albany Medical Center. But we don't have that equal representation for St. Peter's. So I think if we like that would be for everyone.
Yeah.
Well, I think maybe if we're talking about a retreat or some type of a kind of brainstorming session, maybe we develop what subcommittees would be of benefit to us now as a region. Some of these are nice, but they're not, the nominating committee. Okay, that's great. Do we even have, I mean,
Are they serving
but it's a one time a year thing, so it doesn't have a continued function. So not to downplay the nominating committee in any way, shape, or form, Mr. Frank, but I'm just saying, maybe get committees that are more work groups, more tags, more, have a function, a goal, and maybe we'll get more involvement from the field, the
Absolutely.
people, because like you said, the awards committee, what's there really to do for the awards committee? You compile it, you get it out, everybody votes. There's really no reason to have a whole committee that meets on that. So I think maybe if we did some kind of brainstorming session where we came up with some functioning subcommittees, and like Steve said, they meet at least at the state level, we have at least a conference call once or twice between the state meetings to kind of, and then there's even subgroups of that are working on even smaller pockets of things, part of the bigger picture. So maybe that's something we should work on, because I agree with you. It's frustrating because you sit here and we go through the meeting fairly quickly. We don't say a whole lot. And then another month goes by, we do the same thing. I don't mind doing the work if we're going somewhere, if we're
And
doing
especially,
something.
Like I said, speaking of operational things, I think there are a good number of things that necessarily this may not be the forum for that. But if say issues for lack of a better term, but if things can get worked out and discussed at a smaller level.
Right. We don't need to see the
then-
sausage being made in every single group. We just want to see, but you can come back and present to the bigger group what's going on.
Yeah, I was gonna say, Lynn, if you want to jump in, I see you have your hand raised, but
I think
by all
many
means to speak.
Many topics, and especially.
I have another issue I have to bring up, so don't
Okay.
forget me.
Okay, nope, not a problem. And yeah, I think, what you said is actually great, and that's probably,
I think many of
if
these-
it weren't discussed at this retreat,
Yeah.
it's probably a great thing, because realistically, you, through this group, probably have a core group of people that could be part of this committee, whatever you called it,
Yeah,
to
I think
address
at
that
larger
issue.
level, many people are hesitant to voice their true opinions.
Yeah.
In meetings, where at a smaller subcommittee type level, maybe their, ideas will run rampant.
Yeah.
Which is good.
And at the state level also, not everybody that's on these subcommittees is a member of the subsco. You don't have to be a member to be on the subcommittee. So you can participate, have information, because I'm sure there's people in the community that you all work with. They would say, oh, so-and-so would be really great at this. This is their thing, but they're not on the council, so, we don't engage them. So maybe that's just the thing. Just a thought. Other people are thinking. Steve, thoughts?
Good?
No.
We'll go to Lynn. Lynn had the,
You're the
Well,
one.
I
Everybody
mean,
here seems.
this is not the time, I mean, that, if we're gonna have a retreat, that's the time to have
Right.
the discussion, not to have the discussion here. I will just point out that, I travel to a lot of other regions where their regional council has a defined set of projects and people that are working on those projects, and they bring them back, and it's a combination of the leadership of the chairperson of the council, the chairpersons of the committees, the executive director, who set an agenda, and we do the agenda, and they hold people accountable to it. I mean, this is not the first time Carol has brought this up. Carol's been bringing this up now for about 2 years. That, you know, what are we gonna do to be more effective? And we keep defaulting to, let's just have less meetings. But we're really not addressing that we have a really important public responsibility to promote and improve EMS in our region. And, you know, either we gotta step up and do it or not, but, you know.
Yeah, I think we need to, because there's so much changing now. And we have been moving way away from transport only, this and that. We've got, you know, treat in place, we've got all this stuff coming our way. You know, we're healthcare, we need to really step up our game, and, you know, we want to play with the big dogs, but we don't want to do the work, so I think we're gonna maybe change the way we think.
yeah. And again, I'll shoot you guys an email, but I think what you're describing in terms of committee meetings is probably a great idea. There may be folks who are hesitant to make comments in the course of this meeting because it's recorded. So, you know, a subcommittee, or however you want to talk about it, is maybe a better way to have some of these conversations and productive discussions at the end.
All right, I gotta say one more thing.
Sure.
We're leaders. We don't have the option of being reticent to say what we feel in these meetings. Say it. Like, if you think Steve Kroll's an idiot, say it. We're the leaders of EMS. I mean, we can't hide behind it's a recorded meeting. This is our job. We've been appointed here to be the leaders of the EMS agency in our region to make a positive impact. I don't want to hear that we're shy and we don't want to talk about stuff, so we got to do it in committees. I mean, I'm going to use Carol's example. Carol keeps bringing up this problem. She's been doing it for 2 years, and I've been sort of trying to bring it up for 2 years, and we haven't made any progress. We haven't picked up any projects that we want to work on as a council, and our meetings become shorter and shorter. There are a few people that Dr. Daly gets involved and he'll do something. You know, a few people that bring things forward, but we got all this stuff we got to be thinking about, you know, the treat and place law, the recruitment and retention. And we just report on it and we move on. And if that's what our destiny is, I mean, I'll still come to meetings, but, you know, then each of us as agencies, you know, Steve Meehan's gonna have to figure out how to do treat and place himself in Valatia without anybody else. And maybe he'll get with, you know, Aiden O'Connor and they'll figure it out in Columbia County, right? Or maybe they'll get with Dean. But we're just spinning our wheels here. All right, I'm gonna shut up for you. You guys just will throw me off the council.
No, I think
No, we need-
you're right.
Maybe
It's
that's
it's just a matter of you know, creating, for lack of a better description, a committee that will study that, you know, outside of the meeting and then report back to the meeting. So it's.
So I would suggest we come up with a date and it doesn't even have to be a fancy retreat, we can come here and just brainstorm, but come up with a list of potential committees that we think we would need, like recruitment retention. We got those funds coming in, we should look at that.
EMS committee, education committee.
You know, we've got, this
Perhaps they should.
hazard
mirror
weather thing, you know, some of the,
Somewhat closely.
to
with the
this-
CMAC, right?
yeah. Come up with
I
specific.
think having a committee, I'm sorry, you know, I think it was TJ who brought that. I'm not sure. I couldn't really tell if it was his voice or not, but I think, you know, a lot of the issues that I brought forth from the nurse committee, being the voice of the nurses in the region, I would love to have subcommittees where we can move these things forward and start executing some solutions to some of the problems that they bring. Because every month, a lot of the problems are the same. I think I was very excited when Beth McGowan, you know, spoke up and said, because she was on the state EMS, that she, you know, she did have a contact with Mary Ramos, so she she was able to help facilitate some of these things regarding the, the transfers. So, and she has someone, Mary Ramo is going to come and speak with us. And that's kind of somewhat of a solution. At least she's going to give us, maybe, some light at the end of the tunnel regarding these transfer issues. But some of the other things that we've brought up with the PCR reports and all of that, I mean, I would love to also help, be part of that where we can then move it forward. I mean, as just the nurses, when they bring the concerns and I bring it to the Remsco, then, I think everyone's right. That just kind of sits there and nothing moves forward and nothing is executed. I mean, I would be happy to be part of it, but you have to have all the players, you have to have the EMS side and all of the other people, like either going to the different hospitals or whatever. But I don't know what the answer is, but I do know, it's frustrating on that side as well. So I think having us be able to, move that forward is I think a big win.
Yep, I would agree. And you're seeing a much better, not to put you on the spot, but you're seeing a much improved attendance in your nurses group, aren't you?
Yes, we are. But, I have to tell you, I know you had said it's kind of like pulling teeth with some of our committee chairs. And it is for me too. I mean, every single nurse committee time we send it out, I asked Dave Galati to send out, an email about the agenda, and he does do that. But then, sometimes it's like crickets on the other end, like no one comes forward. So for the last 2 meetings, I have called every single hospital. I've called Albany Meds ED, the adult ED. I called the pediatric side. I called Ellis. I called Glens Falls, and that's okay, but it's like, unless I make that initial contact and say, hey, the meeting is this Thursday, I hope you can attend. Do you have any agenda items? But, and I know everybody's busy, and I know really everybody's been inundated with, because I know I've been there, but it is hard and it's frustrating. But then also then to go back to them in November, the only thing that's moving, really in the right direction is maybe an answer to the transfer concerns. So yeah, we do talk about the issues, but I would love to have us move forward with some solutions.
Sounds good. Anything else from anyone?
Me?
Lynn,
Oh,
don't forget
Lynn.
Lynn.
Me?
Oh.
Okay. Magically, message has gotten to me from Alan Bell that he is interested in continuing on the council. So at this time, I'd like to make a motion for Alan Bell to be reappointed to the council for another 4-year term.
All right, I got a motion by Lynn, a second by Steve. Anyone have any questions on that motion? Seeing none, anyone wishing to vote no or abstain? All right, we'll call that motion carried. Thank you, Lynn, for your
What-
perseverance and getting that
Okay.
in during the meeting.
Just one quick question.
Yep.
About the open spots, the at-large seats that are becoming open. We had a recent bylaw change, and while you all were talking, I'm going through my bylaws trying to find the most recent change. Carol, could you assist me? What did we do to the last one?
We just cleaned it up to match the, what the state requirements were for membership, and we, changed the meetings to no set schedule, but basically as decided by the group.
Yeah, but there was
I don't
something
get
about
the-
whether a person needed to work or needed to live.
Yeah, we took that part out because that goes against what the state says. The state says you have to live in the region with that
You
you're.
have to live in the region.
Live in, yeah, it doesn't give you the option for working it.
Okay, thank you. I'm already getting questions. Wanted to
Yeah,
be
no,
able to answer them, right?
Yeah, I think we have to make sure we've got our latest version typed up and out. Thank you.
Okay,
That's all I had
thank
to
you.
say.
Thank you very much for your help, and thanks, Jim.
All right, sounds good. Thank you. So without anything else, our next meeting would be October 28th, Monday. If nothing else, I'll take a motion to adjourn. Motion by Steve Kroll, second by Carol. I would assume everyone is in favor. We'll see you in a month.